Dr. Prasad, because of having the helicopter there, and that's manned, there's a person who lives there and is available 24 hours a day. And when
the pilots
the
are there.
pilots, yeah, who can fly it. And you told me earlier that when you get ready to do a STEMI, you let them know that just in case?
We make a phone call as part of our protocol. We call them and tell them be on standby.
So if there's an emergency during the catheterization,
yes,
there's a helicopter with its motor warmed up, and
nursing staff,
flight path
attendant,
already determined, and the nurses and the pilot that will staff that helicopter are on standby, ready to go and pull the trigger if you have a medical problem during your care here. You're just a quick helicopter flight away, and that's outstanding.
For open heart surgery, if
open heart surgery or there was any complication or something, yeah. So we have been very fortunate. We have not used them, but it can happen, you know, just like life.
And so we keep one helicopter, UNC helicopter, here at all times, correct?
Yes.
Right.
Either it's here or at Wilson. I don't know exactly where it is located.
I
but
believe
not
it's
too
here.
far.
It's here.
It's here.
It's right near Coastal Plain.
Okay.
Yep,
Okay.
it's here, and we have 2 helipads, but one helicopter always here, UNC.
And how long does it take if they, and I've seen that, you know, I get tears in my eyes when I watch it land, because I know, you know, I just say a quick prayer, God, you know, help, because I know somebody's in trouble. But it lands right, there's a pad right beside the cardiology unit,
So
right?
we were part of the team that was deciding when this heart center was being envisioned. And so the helipad was near the coastal plain kind of thing. And I remember Dr. Thacker, my partner, he says, no, that's too far because you have to put them in an ambulance, then you take them over there and it takes 10 minutes, 15 minutes, and it's very critical. And so they made the helipad near the emergency room with the thing that if they need it quick in and out, that's the way to go. And really that has been a very nice thing to have.
And cardiology is right above the ED.
Right above the ER, I mean, they couldn't have planned it better. If you come with the STEMI, we are there during the daytime, we take the patient straight away. And everything we do in cardiology has quality measurements. How long does it take for the patient to show up in the ER and get an EKG done? If you're outside that quality measurements, you get bad points, you know? So,
Well, in all actuality, the EKG is probably done before they even get to the ER by the emergency transport personnel. And
they do that too, yes.
And with our protocols, medications are started in the ambulance by the emergency transport personnel. And so your care happens potentially starting in your living room. They're carried out in the ambulance and continued all the way until you're seen in the emergency room. Then that protocol, those of you who don't work in the hospital, it's announced on the speaker system in the hospital that somebody's coming in through the bay who's
Exactly.
having...
We get a message saying that the patient is 10 minutes away.
The whole hospital knows about it,
Yes,
and that's
yes.
an amazing thing.
It is amazing.
It's the whole hospital gears up to save your life.